Women have been trailblazers in aviation for over a century. As the skies become more inclusive, many wonder, is it safe to fly during pregnancy? Let's explore the unique challenges and precautions for pregnant aviators. Under normal circumstances, pregnancy is not disqualifying for medical certification. But pregnancy does bring about incredible changes to the body, such as an increased heart rate, expanded blood volume, and a growing uterus. These physiological adaptations support the developing baby but can also affect a pilot's performance and comfort in the cockpit. Reduced oxygen at altitude can lead to hypoxia. Thankfully, fetal hemoglobin binds oxygen more effectively than maternal hemoglobin, protecting the baby in most situations. Still, it's essential for pregnant pilots to know their hypoxia symptoms, use supplemental oxygen when needed, and avoid prolonged exposure to high altitudes. Most commercial aircraft maintain safe cabin pressures, but in unpressurized planes, rapid changes in altitude could stress the mother and baby. Additionally, turbulence can cause discomfort or even physical strain, so minimizing exposure is important. In pregnancy, blood flow to the uterus increases, often lowering overall blood pressure. Coupled with dehydration or sudden G-forces, this can lead to dizziness or fainting. Pilots should avoid high G maneuvers and stay well hydrated during flights. Morning sickness affects many pregnant pilots, but not all medications are FAA approved. Always review FAA guidelines or consult your aviation medical examiner before flying on any medication. As pregnancy progresses, airplane ergonomics can become a challenge. Adjusting seatbelts and flight controls for comfort and safety is essential, particularly in smaller aircraft where space is limited. Hormonal changes during pregnancy can disrupt sleep, especially with irregular flight schedules. Fatigue can impair decision-making and reaction times, so prioritizing rest is crucial for both mother and baby. Prolonged sitting during flights increases the risk of blood clots, especially for pregnant pilots. Simple precautions like staying hydrated, wearing compression stockings, and performing in-seat stretches can reduce these risks. Other common changes during pregnancy include preeclampsia, high blood pressure for the mother, and gestational diabetes. These often are not apparent to the mother and should be managed by their obstetrician. The FAA has existing protocols to guide the AME in making certification decisions related to such conditions. Cosmic radiation at high altitudes is a consideration. While occasional flights are generally safe, frequent flyers or long-haul pilots should discuss potential risks with their obstetrician. The FAA recommends pregnant aircrew limit exposure to ionizing radiation to under 80 hours per month. Pregnancy can be both physically and emotionally taxing. Postpartum depression affects 10 to 20% of pregnancies. Pilots should communicate openly with their aviation medical examiner to manage stress and maintain mental health while flying. Ultimately, the decision to fly while pregnant is personal. Many pilots continue flying safely during the first and second trimesters. However, as delivery approaches, grounding yourself may be the best decision for you and your baby. Pregnancy is a remarkable journey, and with proper precautions, it doesn't have to ground your aviation dreams. Talk to your AME and plan for the skies ahead. Fly safe,